My name is Norma Castillo and this is my Introduction to Physical Therapy video project. The clinic I chose is Ruth B. Cowell Rehabilitation Center. Throughout the course of this video, I will discuss the type of setting Ruth B. Cowell provides for its patients. Outpatient care. What is outpatient care? It is when an individual receives treatment without being admitted to the hospital. What do? They provide aid to patients who are in need of physical therapy. Does PTA and PT have in common? A PT will evaluate, reevaluate, provide prognosis and plan of care, and oversee the PTAs. A PTA will communicate both with the PT and its patient, execute the plan of care, have patient interaction, and critical thinking that will help with their patient in case of doing a modification. The types of patients seen at the center are from young children to the geriatric age group, Hispanic, work-related injuries, and a high volume of stroke survivors. With the child therapy, the PTAs will provide the play therapy to help the child with developmental delays, toe walking patients, and patients with cerebral palsy. The various treatments that I did observe from my time at the center were the gait training, balance training, strengthening exercises, Ultra G treadmills, 10 units, cold packs, and heat packs. 10 units, cold packs, and heat packs were used for pain management. Training helped patients with their walking without the use of walkers or any type of aid. Balance training is to help patients with recoordination without the use of walkers or the extra help. Strength training is to help patients regain their muscle strength depending the type of injuries is the type of strengthening exercises that will be given. The Ultra G treadmill is used to help patients walk with 20% less gravity, and this is normally used when patients have trouble walking or have knee or joint problems. The treadmill will help the patients move and walk, and with the cameras it contains, it allows the patients to look at their mobility and help them correct it. I interviewed Ms. Delia Garcia, Elite Physical Therapy Assistant at Ruth B. Cowell. Ms. Delia has a 23-year experience as a PTA with 13 years as an instructor and 5 years working with Ruth B. Cowell. She describes her profession as a calling because she has always wanted to help people and found a career in physical therapy. She has high expectations in the workplace from the team of PTAs she works with. Patient delegation. At Ruth B. Cowell, they have a high volume of stroke survivors, orthopedic patients, and work-related injuries. They can have up to 16 patients a day, and Ms. Delia will assign each patient to the techs depending on their strengths and patient needs. Is a big part of physical therapy. Ms. Delia has expectations as she works with a well-structured team of PTAs and has a great communication between them. She's responsible for supervising patients, students, and her technicians. She makes sure someone is always there with the patient. In this type of setting, it is very important that there is constant communication between the techs and the PT of the facility in both verbal and written basis because a patient's status can change on instances. The plan of care. She always executes the plan of care for each of her patients depending on what the PT has written out for them, and with observations as to how her patients may or may not be doing, she can evaluate to give her feedback to the PT if something has changed or is not working. I asked Ms. Delia what advice she could give me as a pre-PTA student. The only advice she could give me is to always be passionate, to always learn from oneself, peers, and instructors. If you are not sure, always ask so no harm will come to the patient. As a physical therapist or therapist assistant, it is a lifelong learning lesson, and the more you work hard and hands-on for the goal, the more you will learn, and that knowledge you can pass it on to your patients. She also says evaluation and reevaluate the goals to excel the teachings, your patients and their families, which equal family education. Learn to change the view of many that physical therapy is not what the myth says, that it's just a massage. It is more than that, and teach physical therapy can help regain the mobility to the patient who has lost it throughout a health issue or injury. Thank you.